Hi student, welcome to Learn Classic.education. Today we are going to read about nursing management in reproductive tract infection. Starting with role of nurse in RTIs. So first is health education. Health education is very important. We need to give proper health education to the patient. Then early detection and screening. Early detection is needed and screening is needed so that we can prevent complications, provide nursing care, because it is very important. Whatever the doctor is planning the diagnosis, we should provide proper care, assist in the treatment, counseling and support, prevent complication, promote safe practices and community awareness, so that to prevent future RTIs. Okay. Now coming to the definitions of reproductive tract infections. First is reproductive tract infections are infections affecting the reproductive organ. From the name itself we can understand this. Next, they can occur in both males and females. Third is reproductive tract infections are a major public health concern worldwide. Now, early awarenesses, diagnosis, and treatment are essential to prevent the complications and protect reproductive health. Coming to the types of RTIs. First is sexually transmitted infections, that is HIV and AIDS. We know HIV and the AIDS is sexually transmitted infections. Next is syphilis. Syphilis is eradicated almost now, but it is also a sexually transmitted infection and it is very dangerous. Third is gonorrhea, and then come the endogenous infections. Endogenous infections are the one that is caused by overgrowth of normal organisms, normal microorganisms. Okay, so that are known as the endogenous infections. Now coming to the iatrogenic infections. These are the one which is result from medical procedures performed under unsterile conditions. So it is very important to take proper precautions to prevent infections during any medical procedures or surgical procedures. So otherwise it can result into iatrogenic infections. Coming to the causes of RTIs, RTIs, that is bacteria, viruses, fungi, parasites, unsafe sexual practices, poor personal hygiene and unsterile medical procedures. So these are some common causes of RTIs. Now coming to the risk factors. The risk factors are like multiple sexual partners, unprotected sexual intercourse, poor genital hygiene, early sexual activities. Then comes the lack of awareness and low socio-economic status. So these are some of the risk factors. So what are the risk factors? That is multiple sexual partners, unprotected sexual intercourse, poor genital hygiene, then early sexual activity, lack of awarenesses and low socio-economic status. Now coming to the signs and symptoms. Abnormal vaginal or penile discharge. So these are some common signs and symptoms, that is abnormal vaginal or penile discharge. Then itching and irritation, lower abdominal pain, pain during urinations. Then comes the pain during sexual intercourse and genital ulcers or sores. So these are some common signs and symptoms for reproductive tract infections. Now complications, what complications it can lead to if not taken proper care, means if at the beginning the screening and detection is not done, then it can result in the complications like infertility, pelvic inflammatory diseases, that is PID, ectopic pregnancy, chronic pelvic pain, increased risk of HIV infection and pregnancy complications. So what are the complications? That is infertility, infertility, pelvic inflammatory disease, ectopic pregnancy, chronic pelvic pain, increased risk of HIV infection, and pregnancy complications. Now, coming to diagnosis, the common diagnosis through which we can diagnose the RTIs are medical history assessment, physical examinations, laboratory test, blood test, urine examinations, culture, and sensitivity test. So these are the common tests through which we can diagnose RTIs. Now, coming to the prevention, how to prevent, like we always know that prevention is better than cure. So how to prevent, that is practice safe sex, then use condoms consistently. Practice safe sex means you should keep in mind that there is no pain while intercourse. Okay, then use condoms consistently, maintain personal hygiene, regular health checkups, health education and awareness, then early diagnosis and treatment. So these are the common steps to which we should follow for the prevention of RTIs. Now, treatment and conclusions, that is the treatment which we should follow, that is antibiotics for bacterial infections, antiviral drugs for viral infections, antifungal medications for fungal infections, and partner treatment when necessary. Okay, now the conclusions is RTIs are preventable and treatable. So there is nothing to worry because it is preventable and treatable. Early detection and proper treatment reduces the complications. If it is detected early, proper screening is done, then the complications is reduced. Awarenesses, that is health education, should be properly given, and safe practices are essential for reproductive health. Okay. So that with that we can conclude the today's sessions. Thank you.